How was your experience?
It's amazing, actually. We're seeing diverse cases and we're seeing a really large volume. The speakers are knowledgeable, they're helping us a lot, and they are really to the point and concise.
Everybody was on time, very punctual. Yeah.
Glad to be here, part of the BII grant, and we're happy to see that this event finally reached us. From the attendance, from the feedback, from the echo in the region, we feel that more and more we need exchange between different countries, different experience. With the help of Dr. Nikita, we see that education is key. Doctors are engaging. The more we share, the more we benefit our patient in the region.
First of all, the lecturers are very knowledgeable and their expertise with a wide experience. So thank you to Dr. Nikita and Dr. Supriya, and also to the staff. They're very organized, they're very courteous, and they assist us in everything that we need. Even if we don't tell them, they could anticipate what we want and what we needed. And very organized, and they're just at the back, and they could already know that if we need assistance.
First 2 days, Mammogram Bootcamp was an eye-opener. I think Dr. Nikita has got an amazing collection. So that was interesting to see, interesting how other people report, how she looks into cases, and her experience she shared with us. I think that is very, very important. No matter how many years of experience you have, other people's experiences are really interesting, and you learn from them.
It is wonderful the way BIE has systematically arranged everything, how you all started with mammo, and you all have touched on all the. So it's been like a continuous journey. I mean, I wouldn't say that even somebody, if they opted for mammo, that would be a complete experience too, but doing all the sessions together, it's a more comprehensive feel to the program.
Organization was amazing, and the time, the punctuality, I was amazed. I was late by 2 minutes and the lecture had already started, but I think that was necessary also, because otherwise it would be very difficult to do so many things at the same time. So organization was very, very good.
Actually, and it was very structured. These 2 days, I noticed that there are a lot of effort was we're done here in this.
What did you learn from this course?
I must say they started from the very basics and took us all the way through. How you interpret a mammo, position a patient, and how the history is, and how it's very different to approach a screening mammo, diagnostic mammo, which is practically a very important point for us, because we cannot be doing the same thing on a patient what we do for a diagnostic patient. And the history, the follow-ups, and everything was touched on. And then when you do find something on mammo, what do you do next? Even that was touched upon, which is great.
I learned a lot. So it's been really useful to be able to chat with other breast imaging radiologists and with the faculty, so particularly Dr. Nikita and Dr. Supriya, both wonderful. So answered a lot of my questions. It's really very, very nice to see many, many cases with varied pathology, some pathology that I hadn't seen before as well.
The mammography session, I particularly enjoyed the talks on CSM as well as tomosynthesis. I think that Dr. Supriya and Dr. Nikita, they have very updated knowledge, especially on the recent developments, for example, screening programs, and on the latest technologies, advances on these areas, which it will be really condensed in 2 days, and it really improves my knowledge on these areas. Also, I like the cases that they've chosen to discuss with us, because it's very nice and interesting. We don't normally see them in our day-in, day-out practices.
How was your experience with AI?
So honestly speaking, I never thought artificial intelligence would really help us so much. I always had this feeling of, okay, maybe it might take over radiologists' profession. But then looking at Dr. Nikita's association and, at her workplace with the artificial intelligence, I think it is really useful. And it really gives us confidence in giving both positive cases and also passing away the BIRADS 1 negative cases with confidence. Yeah, it was quite impressive.
Yeah, sure, we have already tried to have now, after that conference, we will have hearing.
I'm actually fascinated by the LUNIT AI program. I like the speakers. They are very knowledgeable of their algorithm, and it's also very promising figures they've shown. And during those 2 days, we actually have chance to go through the AI demos, and I'm very fascinated by AI on DBT, which is a very new area as compared to AI on simple 2D mammograms. So I think I'm very fascinated on the new technology.
AI, I must say my perception completely changed, because initially, you hear the word AI and then you think, is it going to replace me? Is it going to help me? Or is it just another extra tool which is insignificant? But I would say I was very surprised. And my first experience with AI and for mammo and the cases which Dr. Nikita had all worked up with AI, and even when AI was applied retrospectively, it's a very good experience.
Would you recommend this program to others?
I definitely would. I think it's the opportunity to have a dedicated period of time where all you're doing is the mammography. So the word bootcamp's a very nice description of what we do. To be able to look at literally hundreds of mammograms in a dedicated session is wonderful.
I mean, I would recommend it to people to come, especially if you think, look, I'm not confident. This would give you an exposure, and it will definitely give you a lot of insight of things which can go wrong, which can happen, which cannot happen, and how you deal with it. I think that's for a clinical radiologist is very important.
Yeah, definitely I recommend it. I've already started recommending it, but yeah, this is something which, if anybody is interested in breast imaging, this is something like I was saying, like this is like a one-stop solution. Whatever questions you have, you don't have to like go through millions of articles and millions of lectures and courses. Just attend this one course and you'll have this integrated knowledge about breast imaging. So definitely I'll recommend it.
On a scale 1 to 10, where do you rate the program?
I would definitely rate it a 10.
It's definitely, it's 11 out of 10.
10 on 10.
10 over 10.
I would say 10.
I'll give you guys 9 just to work harder for next year to make it better.
I would give it 9 to 10 out of 10. I would